Hey there, my name is Brian McKay. I am the owner and founder of Pain Free Fitness. I'd like to welcome you to this short presentation explaining a little bit more about what it is that we do, who we help, and if we're going to be a good fit for you to be able to help you to get out of pain, get into shape, and deal with any potential chronic disease. So again, I'd like to thank you for taking the time. I'll make this as quick as possible. I know your time is just as valuable as mine, so let's go ahead and jump right in. So the first thing is to explain that this picture right here is what is called the Czech Survival Totem Pole. So I'm going to break this down for you real quick. So everything this is basically a hierarchy of survival needs. So the most important thing for us to be able to survive is the ability to breathe. So not only in through our nose, out through our mouth, into our lungs, but also at the level of each individual cell being able to utilize oxygen and glucose to basically use fuel. So similar to a car in that a car uses oxygen and gasoline, and that mixture the same goes for each individual cell. So again, if we can't breathe 3 to 5 minutes, we're dead. So again, this all goes back to just a survival base. Now the second is the ability to chew and the function of the jaw. Now what happens is if our jaw gets out of alignment for whatever many different reasons, or if we're frequently grinding our teeth or anything like that, it's going to cause a lot of issues. So with that being said, if one side of our jaw tends to be more strong, used more, the muscles are actually larger than the other side, we're going to basically shift our jaw, and we're going to go ahead and create some issues down the line. So if my jaw is shifted to the left, I'm going to end up rotating my head to keep it on plane so that my eyes can still look at the horizon. So the next, so again, with the ability to chew, if we grind our teeth out back, a couple thousand years ago before electricity and blenders, we're going to basically end up dying of starvation because we can't chew. So again, everything comes back to a level of survival. Now the next is the ability to see. So not only being able to see potential predators, but also being able to see potential prey so that we can eat. And again, same thing, the ability to hear. Need to be able to hear our potential predators and hear potential prey. Now what happens is, and I'll give you the example for myself, my right eye is stronger than my left, and my right ear is also stronger than my left. So what ends up happening is I actually end up rotating my head to the left to be able to basically look and hear with my dominant side. It's something that I don't do consciously. It's just a basically a something that we do unconsciously. Now what happens is if I'm always constantly rotating my head to the left, what that's going to do is that's actually going to rotate the atlas bone. Now the atlas bone is, atlas or C1 is the uppermost vertebrae in the spine. Now with that being said, the brain stem is the basically the home of our nervous system and every nerve in our entire body. So it starts there and it runs through our entire spine. So every nerve in the entire body runs through the atlas bone, and then from there, between each vertebrae is where each of our nerves spread out into different parts of the body, different muscles, different organs. So if every nerve in the body runs through that bone and it's shifted out of place, which it can easily do because it is a free-floating bone, it has no bony connections to either the skull or the second vertebrae, what happens is it's going to pinch off nerves, and we never know what nerves it's going to pinch or what symptoms we're going to get. A lot of times we actually have symptoms that we don't know is a cause from that atlas bone being misaligned. So with that being said, the function of the organs. So let's say my atlas bone is shifted out and it decides to send some interference to the nerve that leads to, let's say, my stomach or my heart. My stomach or my heart is not going to function at full capacity, and I'm only going to be able to basically be as healthy or as strong as my weakest link. So again, everything again, for survival, our organs are far more important than our muscles. Again, on a survival level. So looking again at the limbic or emotional system, all the thoughts that we think actually create our emotions, and then our emotions negatively tend to be stored within our body, and positively sometimes we feel them as well. So this is the only part on the totem pole that can actually move up and down on the totem pole. So somebody could be breathing just fine, you know, both in through the nose and out through the mouth, and also cellularly. But if we're thinking, you know, just purely negative thoughts, suicidal thoughts, creating, you know, negative emotions, we can decide to commit suicide even though we're able to breathe. So again, this is it's not a pleasant thing to think about, but it is something that is very real, and so it is something that needs to be addressed. Then the next thing is looking at the sacrum and the coccyx, or the coccyx, another word for that is the tailbone. So again, our nerves start at the brain stem, run through our spine, and end right at the tailbone. So the position of the pelvis in relation to, let's say, the rib cage, in relation to the spine, can affect a lot of things as well. And then everything else, you see the slave joints, everything else is a slave to everything up higher on the totem pole. So our ankles, our knees, our hips, our low back, our shoulders, everything in there is a slave to what's going on higher on the function. So this way we're able to look more at what's going on at the root cause, rather than, oh, my knee hurts, let's address that, or my low back hurts, let's address that. We're actually going to be looking at the root cause of whatever your symptoms may be. So with that being said, we always begin with an in-depth hour-long assessment. So this is an example of the first assessment that we do with everyone. This is a plumb line test. So we need to be able to look at what's going on within the body. So if you look at the anterior position, the plumb line is lined up right in the middle of his feet, but yet his head is shifted slightly to his left. And then again, looking at the back, again shifted slightly to actually the right that time. And then on the lateral view, looking at being able to make sure that everything is in alignment there. So that's just one of the many assessments that we do to know exactly what the length-tension relationships are within each individual muscle in the entire body. So the old song, the head bone is connected to the neck bone, it's true, and the head bone is connected to the toe bone through many different muscular and myofascial connections. So being able to look at the whole body rather than a lot of places, if you come in for knee pain, they're going to look, you know, they're only going to look at your leg. They're not going to look at other things that could potentially be a driving cause. So that is going to be the musculoskeletal part of the assessment. Now the next is, this is a written assessment that we have you fill out, and this is just taking a look at all the different basically organ systems and the function of how your individual body is functioning. So again, looking at the mental emotional components, looking at the organs is very, very key. Like I mentioned, if the let's say there's inflammation in your digestive system, it's actually going to shut down the function of the muscles of the abdomen and core and back, and oftentimes that will actually be a cause of low back pain, Low back pain is often in line with hip pain, knee pain, and potentially ankle pain as well. So again, everything is interconnected. We need to be able to treat you as a whole person: physical, mental, emotional, and metaphysical. Now, again, this is going to be looking at this is a diet, exercise, and sleep diary. So need to be able to look at what you're doing, what's working, and what's not, because what you're doing is gotten you to this place in time. So we need to be able to look at how you're eating, how much water you're drinking, what kind of fats and oils you're consuming, condiments, what kind of exercise you're doing, and how long, what kind of relaxation you're doing, what you do for happiness, how you slept, what time you slept. Did you wake up in the middle of the night? Did you wake up feeling refreshed? And then always people's favorites, looking at bowel movements. We never force anybody to do anything they're uncomfortable with. So if, for instance, some people are not comfortable sharing about their bowel movements, and that's fine. There is a lot of information that we can get from that, but not necessary. So if you don't feel comfortable with anything we're doing, we can always not do that, basically. There's no amount of information that we can get that's worth putting you into an uncomfortable position. So first thing we do after we do the initial physical assessment and looking at the written assessments that you then give to me, come back and work on some nutrition and lifestyle coaching changes. So potentially looking at if you're eating the correct foods for your body, in what ratios, all kinds of different things like that. So again, just being able to sit down for an hour, look at what you're doing, talking about what's going to be, what you're willing to do, what you're not willing to do, and what you might be willing to do in the future. So we always want to work with where you're at, what's the easiest thing for you to do at this point in time, because there are so many changes that most people need to make will overwhelm someone. So what we want to be able to do is to just go ahead and basically small changes one at a time, or a couple at a time max, so that it's not too much to handle. So after that then begins with our basically teaching you our system. So these are again taken from the CHEK Institute, CHEKinstitute.com. These are the primal pattern movements. So we've got a squat on the left, we've got a lunge in the middle, and a bend on the right. So these are all basic leg patterns. So the majority of what we do is going to be some form of walking, bending, sitting, squatting, stepping over something. Our legs are incredibly important. Women tend to work on their legs more than men, but they're incredibly important and a foundation for everything that we do. So we need to be able to do these movements correctly without pain. So just to be clear, a squat, a lot of times people will say, oh, well, you shouldn't squat if you have knee or hip pain. Well, how am I going to sit on the toilet or sit into a chair? I'm not going to be able to. Same with a lunge. Need to be able to lunge, need to be able to bend over and pick something up. Should we lift with our legs? Sometimes. Sometimes we need to just be able to bend over and basically brace our core and use our back. So those are the basic three lower body primal pattern movements. The upper body ones are going to be a push, like this woman doing the push-up. We've also got the woman doing the cable pull in the middle, and then the woman doing a twist over on the right. So being able to rotate. One of the prime examples would be a grocery checker who's always rotating, scanning the groceries. Golf swing is a great example. Things like that. So any movement we do is going to be a combination of any 6 of these movements. So for instance, throwing a ball is going to be a combination of a lunge, a push, and a twist. Just again as an example, a golf swing going to be a bend and a twist. So whatever it is we do, picking up our children, it's going to be a combination of a bend and a squat and a pull. So everything we do is going to be one combination of those 6 basic movement patterns. So being able to do them correctly without injury. So that's basically the foundation for the movements that we do. Now, when we start working with, again, the body, we want to be able to, if someone is in pain, which most of my clients come to me in pain, we're going to have to focus on mobility and be able to move our joints through full range of motion, as well as being able to stabilize the joints as well to prevent any issues. Now, the majority of pain is actually stems from basically an instability. So if I have an instability in the core, a lot of times my low back is going to hurt. If I have an instability in some muscles in the shoulder, in just say a couple of the rotator cuff muscles, it's going to create issues elsewhere. So we need to be able to get our clients to be able to move through full range of motion and stabilize those joints safely. So generally that's about a 4 to 6 week process. Now the next is moving into a strength phase where we're actually doing things with a little bit heavier weight. Again, that's going to be dependent on your present needs. Sometimes the mobility and stability work is just body weight, and other times it begins with weight. So it's very individualized. So we're not we're working with a 70-year-old lady. We're not going to start working with a 50-pound barbell right off the bat. That's crazy. So we always work within each person's individual needs. So again, doing the strength phase, we're going to do lower repetitions, higher weight. And then again, that lasts for about 4 to 6 weeks, individual dependent. And then the last is a power phase where we're actually doing things in real life speed. Because if we were to pick up a couch, we would not want to bend down and pick it up at a bending down 1, 2, 3, and standing up, picking it up 1, 2, 3. We're going to bend down, pick the thing up, and be about our day. So that is a basic breakdown of the different phases that we do. And the nice thing about this is this is just a very basic periodization pyramid to be able to rotate back through, and that is a fantastic way to exercise through the rest of your life. So just continue to cycle back through. So looking at what a first session looks like. So again, once we've done the physical assessment, once we've taken a look at the nutritional lifestyle portion of things and done that coaching, we start with doing some work with the actual body. So we actually begin by releasing short and tight muscles. So you see the picture on the left, usually working with the head and the neck. That's going to be a very common thing with most clients. Again, completely individualized, so it may be slightly different for you. The girl on the right is using a foam roller to relax her leg muscles, which again, those particular muscles can, if they are tight, they can often be correlated with low back pain. So again, teaching different ways for you to be able to release your short and tight muscles, and so that's usually about the first 3/4 of an hour of our first physical session. Then usually about the last 15 minutes, we're going to work on actually strengthening long and weak muscles. So being able to work again within your present abilities, not pushing too far, making sure that you're actually able to do the exercises and do the exercises correctly. So this is an example of an abdominal exercise that we teach pretty much all of our clients, being able to basically get on all fours and use the deep abdominal wall. So again, just an example, and then working on whatever other muscles need to be strengthened. So Again, we may use modalities such as self-massage, myofascial release, whether it be using your own hands, using implements like a foam roller, a tennis ball, anything like that, craniosacral therapy, neuromuscular therapy, corrective exercise, very similar to physical therapy. Reflexology we've done depending on your symptoms. I know one of the most common uses for it is if somebody comes to us with diabetic neuropathy and lack of feeling in their feet, we can actually get some wonderful results from that, getting that feeling back in the feet. And again, the nutrition coaching, the lifestyle and mindset coaching, cupping therapy, grounding, all sorts of different techniques. One of the things we like to do is keep a vast set of tools in our toolbox, because if the only tool you have is a hammer, everything looks like a nail, and that tends to be common with, let's say, massage therapist, which, God bless them, massage therapists are wonderful, they have their place, but it's not the end-all be-all cure for anything. Just like a chiropractor, just like a acupuncturist, whatever it may be. We need to be able to look at what the root cause is and address that, and not get hooked on any one particular modality just because that's what we specialize in. So, and I guess the last thing here is, this is an example of an email that I send to all of my clients to be able to have them do these exercises at home. So looking at the uppermost part of this is going to be mobilizations and stretching. Again, being able to go ahead and bring the body back into alignment, relaxing the tight muscles, and then in the bottom we're looking at the corrective exercises to strengthen the weak muscles. So this is a picture, but in the email you see all of these exercises are hyperlinks, which you can click and take you right to a YouTube video to remind you and reteach you how to do these exercises correctly. One of the biggest complaints that I've had myself from, again, let's just use physical therapy, is we get a sheet of paper with a few stick figure drawings for exercises, and really the form and the technique is far more important than just doing the work. So again, being able to look at the videos to remember how to do these things correctly. So with that being said, that is a basic understanding of what it's like working with Pain-Free Fitness. At the beginning, what we end up doing is oftentimes we will end up as we progress, we'll cut down on the number of manual therapies and mobilization and stretching that we need to do, and start to increase the difficulty of the exercises as we get better. So, we can make any exercise pretty much as difficult or as easy as we need to, depending on your individual needs. So again, I'd like to thank you for taking the time to watch this short video, understand a little bit better about what we do. If you do have any questions, please reach out to us at 248-904-2526, or you can check out our Facebook at facebook.com/painfreefitness, or again, our website at painfreefitness.net. So again, I'd like to thank you for taking the time to watch this. I hope this has been informational, educational, and gives you a better understanding of what it is that we actually do. So thank you again, and hope to hear from you soon. To good health. So with that being said, that is a basic understanding of what it's like working with pain-free fitness. At the beginning, what we end up doing is oftentimes we will end up cut as we progress, we'll cut down on the number of manual therapies and mobilization and stretching that we need to do and start to increase the difficulty of the exercises as we get better. So, we can make any exercise pretty much as difficult or as easy as we need to, depending on your individual needs. So again, I'd like to thank you for taking the time to watch this short video, understand a little bit better about what we do. If you do have any questions, please reach out to us at 248-904-2526, or you can check out our Facebook at facebook.com/painfreefitness, or again, our website at painfreefitness.net. So again, I'd like to thank you for taking the time to watch this. I hope this has been informational, educational, and gives you a better understanding of what it is that we actually do. So thank you again, and hope to hear from you soon. To good health.